Welcome everybody. Today's topic is based on the symptom dizziness and fainting. Many people are often confused about who and when to ask for help because of dizziness. Because they feel why to bother their doctor with small complaints. What is dizziness and fainting? Dizziness is actually feeling slightly unsteady. True dizziness or vertigo is when you feel everything is spinning around you, and this is not a normal condition, and it can result from various causes. We will see each of the cause and a little bit of explanation in each of them. The first cause, it could be due to any kind of medications as a side effect or due to alcoholic consumption. Drinking too much alcohol, you may feel episodes of fainting, and this is very common in alcoholics. If you're taking any kind of medications, it could be drugs, some kind of medicines like antidepressants, anticonvulsants, or antihypertensives, drugs to control high blood pressure, then also you can feel dizziness. Dizziness due to medications. Pregnancy lightheadedness. Feeling faint during pregnancy is fairly common and not usually a cause for concern, but due to hormonal changes in pregnancy, the blood vessels tend to relax and hence lowering the blood pressure. The pregnant woman could experience frequent attacks of lightheadedness. If she finds it as a problem, then she should see a doctor at that point. Next cause. The next cause for dizziness could be anemia. Feeling tired or lack of energy may lead to fainting, pale skin, rapid heart rate, and headaches. Low blood pressure. Lightheadedness. Even in minor head injury, there could be the minor head injury could be due to some bruise or you had a fight with someone, and due to mild headache or nausea you could feel dizziness at that point. Even in heat exhaustion, when you're standing for prolonged hours under the sun, and you may feel fainted. Feeling of faintness could be present at that point with headache, weakness, and intense thirst. Another could be cervical spondylosis. There could be in cervical spondylosis, there could be dizziness, unsteadiness, double vision. It could be brought on because of the moving head. And mild to moderate pain could be there due to extension from the neck and back of head in cervical spondylosis. So these were the some causes of dizziness. And what are the emergency cases in which actually you need to go to the hospital and get admitted? We will see next. In emergency cases, if you're feeling shortness of breath and persistent chest pain, you're unable to breathe, and the chest pain is prolonged it is persisting, and you have lost your consciousness. If there is abnormal heartbeats or heart palpitations, some kind of arrhythmias, or you're having serious head injury due to some kind of high impact vehicle or any kind of seizures. These are the emergency cases where you need to seek medical help. In transient ischemic attack, the symptoms are similar to stroke, but they are short-lived and they may completely recover after within 24 hours. But this is a medical emergency condition. Another one is stroke, which is also a medical emergency condition. In stroke, there is dizziness, loss of balance, coordination, drooping of face on the one side. There is paralysis. Basically, there is paralysis of one side of the body, slurred speech, double vision, and other medical emergency conditions. So you check down at what time you're having dizziness and fainting, where these symptoms are arising. Is it emergency symptoms or is it a normal symptoms due to some other cause? Vertigo disorders. In the first slide, in the initial slide, I said true vertigo is when you're feeling spinning around of objects around you. Vertically is generally associated with the ear and the brain. There are 4 conditions where you will find these vertigo disorders. First is benign paroxysmal positional vertigo, wherein there is sudden onset of vertigo. You'll find sensation that your surroundings are moving and spinning around when moving your head. But there will be no ringing in your ears or any kind of hearing loss, but you will still feel something is spinning around and moving around. That is benign paroxysmal positional vertigo. Next condition associated with your ear labyrinth is labyrinthitis, where there is vertigo. Dizziness is still there, but it is worsened by changing of head position. Just like benign paroxysmal positional vertigo, you changed your head, moved your head, and then you started having fainting episode. So in labyrinthitis, there you will find ear disorders also, like tinnitus. Tinnitus is ringing in your ears, and hearing loss, and sometimes fever, and feeling of fullness and pressure in ear also may be present in labyrinthitis. Next condition is Meniere's disease in vertigo disorder, where you'll have frequent attacks of vertigo and hearing loss and tinnitus. But these may last for only few minutes or several days. It could be for several days and it could be for years also. Acoustic neuroma, another condition. The 4th condition, there is one-sided slowly developing hearing loss with tinnitus, loss of balance, along with headaches, numbness and weakness of face on affected side. So in acoustic neuroma, you're having a palsy of one side, means weakness of face on one affected side of the ear, and slowly developing hearing loss. So these were the vertigo disorders. Thank you for watching. Like, share and subscribe.